Here we see almost all type of congenital heart defects, ranging from a very simple ones like a hole in the heart wall, up to a very complex one, let's say absence of the heart chambers, 1 or 2 heart chambers, absence of the heart valve, or absence of the arteries. But very fortunate that the majority of the heart defects, they are simple. Just unfortunate that the majority, we just don't know the cause. Even though defect is presumed to be genetics, but so far there are only a few genes that have been shown to link to a defect. But we do know that there are many conditions that might increase the risk of congenital heart defect. Let's say genetic syndromes, especially Down syndrome, which involve the abnormality of the chromosome, and these children will have a delay in development and many other organ systems, including the heart. Roughly around half of them will have a heart defect. The other syndrome, like Turner syndrome, which affect the female and cause a short stature and failure of the secondary characteristic, they also have around 25% will have a narrow of the arteries of heart valve. The other type is the Noonan syndrome. Around 80% of them will have a heart defect. Other than the genetic conditions, there are maternal conditions too, like maternal DM. If the DM is very poorly controlled, then there is around 5 times chance that the baby will have a heart defect. And also maternal consumption of alcohol. If they consume too much, the alcohol have a poisonous effect to the tissue, and it's caused multiple organ deformities or anomalies we call fetal alcohol syndromes. And the majority of them will also have a heart defect too. The other conditions that risk is, let's say, infections. German measles or rubella is well known that it will cause defect in multiple organs and also the heart too. And recently we know that flu, which is very common, and it can also cause the heart defect too, which we don't know why. And certain medications also can cause a heart defect, especially those for anti-epileptic or anti-seizure medications, medication for treating acne. Okay, either taken by mouth or topical, they can also cause a heart defect. And the more common one is ibuprofen, which is a common painkiller, also can cause heart defect. So overall, there are many causes that can increase the risk of the heart defect, but we don't really know exactly why. Normally, the heart is function as a pumping. It just circulates the blood throughout the bodies, and we can say that we have 2 types of circulations. One is the lung circulation, the other is the body circulations. When the blood returns to the heart will just pump to the lungs, to the right side of the heart, to get supply of oxygen, and then return back to the left side of the heart. And from there, it will just pump to the whole body to just deliver of the oxygen to every cell. Now, if there's a defect, it may definitely the functions get affected. Let's say if there's a small hole, if there's a hole in the heart wall that divides the right and left side chamber, then there will be a communication that the blood can travel from one side to the other, which it shouldn't be. And that will increase more blood flow to the lung, get congested. And so we'll return to the left heart and get the heart larger. It depends on the size of the hole and the size of the blood that's traveling through. If it's too big, then it's caused what we call a congestive heart failure, because the heart cannot cope with it. Now, when they get a congestive heart failure, they will have a difficulty in breathing very fast, and the lack of energies, and they're not going to grow. They have a poor feedings. In the other extreme, let's say if it is very complex, missing of a chambers, then the 2 circulation will just mix up in the only chamber that left. Then the circulation will just causing the color to blue because the oxygen level in the blood will just get lower. Now, how to treat this? It depends on how deranged the function is, and we just try to reinvent or try to separate the circulation so they won't mix up. We can recreate a pathway for the blood to travel to the lung, bypass the heart, and come back to the heart, to the body. And after doing that, everything will just functions like almost like normal. Okay.